Welcome to the Operatory podcast, the podcast about burying the dinosaurs in dentistry. Moving past outdated technology and procedures to find a better way. With me, as always, is the man himself, Dave Pryor. Thank you for being here, sir.
Hey, Bryan. How's it going today?
Well, it's a little bit surreal, my friend. We just, this might be the second podcast or so that we've done since the COVID-19 crisis. And so it's scary out there for everybody. We're here for you. So 10 minutes a week, we're here for you talking about dentistry and what we can do, what's going on to change our world and how we can react to it. So I think more than ever now, it's going to be important to focus on our patients. And so thanks for being here, Dave.
Sure.
I think that it's easy. It would be easy to not communicate with patients, not communicate with our teams and just like sit home, eat Cheetos and watch Netflix. But I would implore our audience, as I on one of our last podcasts where I was directly talking to our dentist. So if you didn't hear that, I would listen to that episode because I think we gave some good tips on how to survive this and how to thrive on the other end of it. But overly communicate with your teams and your patients. They're looking for guidance. They're looking for clarity. They're looking for some calm. We'll get to the other side of this. So, but make sure to talk to your patients, right?
Oh, for sure. I mean, communication is going to be the key as people are most afraid of the unknown.
Exactly. Yes. And there's been a lot of reactions to this.
Sure.
And there's going to be continually, by the time this podcast goes live, what I'm saying may make no sense anymore. So I apologize if that's the case, but I wanted to point out a big failure that went on. I'm not, I like to focus on the positive on the other end of this, but I think it's more of a cautionary tale. But President Trump, this is not a political podcast, but there was one big mistake that I think has been made, and I think he did it. It might have been somebody else. It could have been the HHS, but they've relaxed the HIPAA guidelines now. And that's whether or not that's a mistake is not really for me to say. They did it, although I'm kind of calling it a mistake because I think is our patient's information not important in a time of crisis. Once that toothpaste is out of the tube, you cannot put it back in.
Right.
And so do we just relax our security and privacy because of this? There's plenty of tools available that people can use that are compliant. And they're easy to use. So why are we relaxing the guidelines? As a patient, Dave, how would you feel about knowing that, now just it's a free for all for the next 90 days?
I think it's insane. I don't. It makes no sense to me that because there is a health situation in this country that you'd lose your rights.
Yeah.
That your government mandated rights are now open for everyone. Meanwhile, I don't know. I'll be excited to see when Donald Trump's medical records get published because that's,
he's in perfect health.
It's inevitable.
Yeah, no.
It's inevitable.
Well, so here's what I would say is that, let me look at it from the other perspective.
Yeah.
That as a patient, if I want to communicate with my dentist, with my healthcare provider, and I want to do it via FaceTime, then those I can see the deregulation from that side.
Sure.
But what I'm seeing is people scrambling on the healthcare side, on our side, going, well, for the next 90 days, we'll do it this way because we need something, and we've been sitting on our ass not using Opera DDS's teledentistry. And so, rather than figure out how to do it right, we're going to switch and go to FaceTime. And I'm just like, why? So you can put people's information at risk? I mean, I can totally see how this passed through because as a patient, I don't want to not be able to get the information that I need because the person on the other end hasn't done their job.
Right.
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 But that isn't incorporated into the regulation or deregulation at all.
Right.
So, yeah.
Well, it seems to me as a patient, like if this is if this is something that's required, then why isn't the regulation already updated? If FaceTime is required, if being able to FaceTime with somebody is something that's required,
it's not required.
No, by a doctor. I as a doctor need to communicate with my patient via FaceTime. Okay, then why isn't that already mandated within HIPAA in terms of a practical use?
Well, it's not HIPAA compliant,
right?
Right?
But,
yeah.
So if it's not HIPAA compliant, then there's a reason behind that.
Oh yeah.
And so, like,
I hear where you're going.
Yeah, and so if like HIPAA's out of date, great, update it. But I don't think that's the case.
That's not the case. No. And here's the other risk is that people don't understand HIPAA to begin with.
Right.
And it's there's some gray areas, and it's not really complicated, but it requires a lot of thought and energy to sort of understand if you got a busy practice to run.
Yeah.
And so having people understand what they can use now that's okay for the next 90 days. Well, from a regulatory perspective, okay for the next 90 days, and then figuring out what to do on day 91 is completely unrealistic.
Right.
And so people are either just going to start doing it, or they're going to have to switch to another platform, and it's going to be harder because now they've gotten used to doing it one way, and and I know this isn't going to go 90 days. It's going to go for 6 months or a year, and then. And then rather use, it's not like these tools aren't available. You can use, Zoom has a HIPAA compliant package that you can sign up for. There's tools like Operatory that do it very well in dentistry, that we're talking less than $90 a month. And so whatever people are signing up for and using that's not compliant is worse in every way.
Yeah.
And it's not designed for what we're doing. I was on a video conference call yesterday where we had a panelist of, I think there was 6 of us, and there was over 500 people in attendance. It was probably closer to 1,000. I haven't gotten the final numbers yet, but we're talking about this, and we're talking about teledentistry. And one of my points was that video conferencing with patients is an exercise in pain.
Yeah.
Right? Nobody wants to talk to their dentist video. I don't want to talk to my patients that way, but they don't want to talk to me. If the thing rings and I'm in my pajamas, I'm not picking it up, and who knows when I'll get back. And then you got this stupid phone tag thing, and then you've got when they're on there, you can kind of bill for it, but nobody's going to figure that out right now, how to bill for consultations realistically. But if you did, what are you going to get, $15, and then you're talking to a patient for an hour? Well, let's do this asynchronously, like texting, right?
Yeah.
And you can't. That's not been deregulated. So at least as far as I know, and so these tools aren't even designed for what patients and dentists want to use. So you're going to start using something that's worse in every way. You're not going to get compensated for it, and then you're going to have to switch in 90 days. It's just the effort on all across the board is worse.
Well, let me remind you of why you created teledentistry to begin with. It was to create something that gives you the ability to have it be asynchronous so that you're not pulled out of what you're doing at the time that you're doing it and have to respond immediately. Number one.
Respond immediately to somebody who's probably highly emotional.
Right.
Right.
Yeah. Number 2 is now you create a documentation stream with the asynchronous application. So now when a patient submits that information to you, not only do you have it in the case of Operatory, you have it in the Operatory application and sitting in your practice management system. So it's easy to go back and refer back. Like, what did I talk to that person about? I had 10 calls yesterday, and I need some sort of way to keep track of what's going on, and that's a perfect solution to be able to do it.
Yeah, I get a little, my blood boils a little bit.
I know
when I know what's going on, because it makes no sense. From our perspective, from this side of the table, Dave, from a dentist perspective, don't do it. It makes sense from a patient's perspective. If the dentist hasn't incorporated teledentistry that's HIPAA compliant now, and I need the information, well, then let's do it. Like, if you haven't done it, just go out and get a teledentistry application like OperaDDS that's easy to use. We're actually doing it 30 days for free and a free setup. So during the entire, 1/3 of the time where you're breaking HIPAA, except for this 90-day period, you're actually going to be getting it for free. So I implore you, just get going with it. Easy to do. It's much better in every way. Like Dave said, it goes directly back to your patient chart with all the notes, and you've got asynchronous communication that you can respond to people on your time with video and photos that you see, so you can get them scheduled. If you're not seeing patients now, hopefully by the time you hear this podcast, everything's back to normal. Yeah. But unfortunately, I doubt it. So there's going to be a lot of us who are just seeing emergency patients, and it's going to be way easier to see them and schedule them for what they need if you can do this with video and photos.
Well, and I want to say one more thing. I know we're ready to check out of here, but how are you going to explain to those patients later when I was able to violate HIPAA during this time, but 6 months from now when the HIPAA regulations are reinstated, then you're going to have to say, oh yeah, I didn't care about HIPAA during that time. But now it's important to me. So as a patient, I'm going to be like, oh, so you don't care about my personal information privacy? Okay, I'm going to move on.
Well, I personally would just say, well, Donald Trump said it's okay. And then you hope they're in the 37% that's okay with him shooting somebody in the face in New York Times, in Times Square.
Times Square,
yeah, exactly. Well, thanks, Dave. As always, I very much appreciate your perspective, the patient's perspective on the podcast. And I look forward to talking to you on the next one. Everybody stay safe out there.
Have a good one.